Most people believe what you do for your teeth twice a year at the dentist matters more than what you do every morning at your bathroom sink. I used to believe that too, until I started counting. In 25 years of practice, the patients with the healthiest mouths at 75 are not the ones who paid the most for dental work. They are the ones who built a small, boring, 7-minute morning routine they did almost every day for 30 years, and they will tell you, almost word for word, that nothing else came close. So today, I want to walk you through that routine, exactly as I teach it to my own family. 7 minutes, no fancy equipment, nothing you have to order. Just the right things, in the right order, with the right intention. By the end of this video, you'll know exactly what those 7 minutes look like, why each one matters more than the last, and which one I would never let anyone in my life skip. I'm Dr. Helen Bennett, 25 years in practice, the last 15 as a biomimetic and holistic dentist, which just means I focus on saving teeth instead of replacing them, and on the mouth as part of the whole body. Before we get into this, do me a small favor. Drop your city or state in the comments. I love seeing where you're watching from, and it tells me who I'm sitting with today. And one important thing, everything I share is educational. It's not a substitute for in-person dental care. Use it to walk into your next appointment with sharper questions and a clearer head. Here's what's at stake when the morning routine is wrong, or rushed, or skipped. Sit with this for a moment. The mouth at 6 in the morning is not the same mouth you went to bed with. While you slept, saliva flow dropped to almost nothing. The bacteria living between your teeth, in the pockets of your gums, on the back of your tongue, multiplied for 8 hours in a warm, dark, low-oxygen environment with no rinse cycle. By the time your alarm goes off, your mouth is the most acidic, most bacteria-rich, most chemically off-balance it will be all day. What you do in the next 7 minutes, before food, before coffee, before anything else touches your teeth, sets the tone for the whole 24 hours. The cost of getting it wrong is not theoretical. Skipped or rushed mornings, repeated for years, are how cavities at the gum line start. They're how chronic bad breath builds. They're how gum disease quietly progresses, while you tell yourself you'll get to the dentist eventually. They're how a small filling becomes a bigger filling, becomes a crown, becomes a root canal, becomes a tooth lost. The clinical downhill almost always starts at the bathroom sink, not in the dental chair. And the systemic side is real. Major journals over the past 2 decades have linked chronic mouth inflammation to heart disease, stroke, blood sugar control, brain health. Your mouth in the morning is the front door to your whole body. I don't tell you this to scare you. I tell you because no one else will. And about halfway through, I'm going to share the 1 minute of this routine, minute 4, that almost no one is doing, and that has done more for my patients' gum health than any prescription rinse I have ever handed out. Stay with me. Let me back up and walk you through the 7 minutes in order, exactly as they should happen. I want you to picture yourself standing at your sink tomorrow morning. The routine starts the moment you wake up. Minute 1. Water before anything else. Before coffee, before food, before brushing. A full glass of room temperature water, sipped, not gulped. Why this comes first matters. Your saliva, which has been almost completely shut off all night, needs water to start flowing again. The bacterial sludge that built up overnight needs to be physically rinsed out before you do anything else. And the acid level in your mouth, which has been quietly dissolving the surface of your enamel for 8 hours, needs to be diluted before you put a toothbrush anywhere near a softened tooth. Here's the truth. Most dentists won't sit down and tell you. Brushing immediately after waking, without water first, drives bacteria deeper into the gum line and scrubs softened enamel. 1 glass of water, 60 seconds. That is the first minute. Minute 2. Tongue scraping. A stainless steel tongue scraper, gently, from the back of the tongue forward. 6 to 8 strokes, rinsing the scraper between each one. The back third of your tongue is where bad breath lives, where bacteria from gum disease colonize overnight, and where most people never clean. A toothbrush will not displace what's there. A swish of mouthwash will not displace what's there. A tongue scraper will, and it takes 60 seconds. The patients of mine who started doing this and only this, with no other change, came back to me weeks later saying their breath felt different, their tongue looked different, their mouth tasted different all day. It is the simplest, most overlooked minute in the entire routine. Minute 3. The brush, finally. Soft bristles, always. The aggressive scrubbing your father did is part of why his gums look the way they did. Place the brush at a 45-degree angle into where the gum meets the tooth, not flat against the tooth, and use small, gentle, vibrating motions. You are not scrubbing a pan. You are massaging a wound clean. 2 full minutes. And most people, when they actually time themselves, find they have been brushing for 45 seconds for the last 20 years. Cover every surface, outside, inside, biting surfaces. Pay extra attention to where the bottom front teeth meet the tongue, because that's where tartar builds fastest. Now, and this matters, use whatever paste you trust. I'm not naming brands. Many of my patients have moved to a hydroxyapatite paste, which delivers the actual mineral your teeth are made of, and the clinical data on it has been encouraging out of Japan for some years now. Have an honest conversation with your dentist about what's right for you. 2 minutes of careful brushing. Now here's the part that's going to surprise you. Most of the protective work is not done in those 2 minutes of brushing. It's done in the minute that almost no one knows about. Minute 4, the minute I promised you. Cleaning between your teeth, slowly, every single space, every single morning. Floss, an interdental brush, a water flosser. I don't care which tool. I care that you do it and that you do it slowly. Most gum disease starts between the teeth, in the spaces a brush physically cannot reach. If you skip there, you have skipped the actual battle. 60 seconds of gentle, complete cleaning between every tooth, every morning, will do more for your gum health than any product you can buy. And before someone in the comments tells me they don't have time, yes, I know, you have 60 seconds. Let me say something that's going to surprise you. You do not have to do every space perfectly. You have to do every space at all. The patient who flosses imperfectly every day will have healthier gums in 5 years than the patient who flosses perfectly twice a week. Consistency is the entire game. Minute 5. The saltwater rinse. Warm water, about a 1/4 teaspoon of unrefined sea salt, fully dissolved, swished for 30 to 60 seconds, then spit. Salt water creates a brief change in mouth chemistry that the bacteria responsible for gum disease genuinely don't tolerate, and it helps the tissue calm down and tighten up. It is old. It is boring. It works. I have watched it outperform expensive prescription rinses in patients who actually do it consistently. The simple things, done daily, beat the elaborate things, done occasionally every single time. Minute 6. Hydration and breath. This minute is not about your teeth alone. It is about everything downstream from your teeth. Drink another glass of water, slowly. Take a moment, and I know that sounds like more than a minute, but stay with me. To breathe through your nose, deeply, calmly, while you do whatever else you do in the bathroom. Mouth breathing through the day dries out the saliva that protects your teeth. Mouth breathing at night does even more damage, which is why I always ask my patients about their sleep. If you wake up with a dry mouth, if you snore, if your bed partner has mentioned it, talk to your physician about your airway. Your teeth depend on the saliva that depends on the way you breathe. Minute 7, the check-in. This is the minute almost everyone leaves out, and it is the one that quietly turns this routine from a chore into a relationship with your own body. Look in the mirror. Pull your lower lip down and look at the gum line on your bottom front teeth. That's the area that shows changes first. Are the gums pink and firm or red and puffy? Did you see any blood when you flossed, and where? Does anything feel different from yesterday? The mouth tells you everything if you bother to look. The patients who catch problems early, before they need a procedure, are the ones who develop the habit of looking. 60 seconds. No equipment. Free. If you only remember one thing from this video, let it be that the morning routine matters more than any single dental visit you will ever have. The dentist sees you twice a year. You see your mouth, or fail to see it, every single morning of your life. Now, where the gap comes in. There are deeper interventions for people whose mouths are already compromised. Ozone therapy in periodontal pockets, professional debridement under magnification, biocompatible restorations, a real conversation about mercury-safe protocols if you have older fillings. Those require a trained biomimetic or holistic dentist. I will not walk you through home versions because they aren't safely DIY. But you should know they exist and that the 7-minute morning routine is what makes them last when you do them. Let me tell you about a woman I'll call Patricia. 67, retired bookkeeper, came to me 4 years ago with a long history of dental work, 3 crowns, 8 fillings, 2 extractions, and a periodontist she saw every 3 months. She told me she felt like her mouth was a losing battle. We did not start with any procedure. We started with this 7-minute morning routine. I wrote it out for her on a note card. She put the note card on her bathroom mirror. 6 months later, her gum pocket measurements had improved across the board. 12 months later, her hygienist asked what had changed because the bleeding was almost gone. 3 years in, she has not needed a single new filling. Patricia told me last spring that the 7 minutes are the most peaceful 7 minutes of her day now, and she actually looks forward to them. I almost cried. Patricia is what consistency looks like. Here's what 25 years in practice have taught me. The dentist holds the instruments, the hygienist holds the scaler, but the toothbrush, the floss, the scraper, the rinse, those are in your hands every morning for 30 or 40 more years. The 7 minutes you spend with them are worth more, over a lifetime, than any single procedure you will ever pay for. You do not need permission to ask hard questions about why no one ever broke this down for you. You need information, and now you have it. Let's pull this together. The 7-minute morning routine in order is water first to wake up the saliva and dilute the overnight acid, 60 seconds of tongue scraping back to front, 2 minutes of careful brushing at a 45-degree angle into the gum line, 60 seconds of slow flossing or water flossing every space, 30 to 60 seconds of warm salt water rinse, a glass of water with calm nasal breathing, and a minute of looking in the mirror to actually check on the gums you only get one set of. That is it. That is the whole routine. The patients of mine who do those 7 minutes most days for years are the ones whose mouths are still mostly original at 75. You are not a passive patient. You are an active participant in your own care. The dentist holds the instruments, but you hold the choice. You decide what goes into your mouth in the morning, how you clean it, and whether you walk into your next appointment with healthy tissue or inflamed tissue. In the comments, tell me, which of the 7 minutes are you currently skipping, and which one are you going to add tomorrow morning? I read them. If this helped, hit the like button, subscribe, and share it with someone over 50 who needs to hear it. Take care of your teeth. They're irreplaceable. I'll see you in the next one.